Good day everyone! Another video, another autobiography of drugs. And for today's video, we will be talking about selective serotonin reuptake inhibitors. And just don't mind my face. But let's get it on to the video. Selective serotonin reuptake inhibitors has a lot of drugs, and these are the generic names of the drug: citalopram, escitalopram, fluoxetine, paroxetine, sertraline, fluvoxamine, and vilazodone. And for the brand names of the drug, we have citalopram for Celexa, escitalopram, Lexapro, fluoxetine, we have Prozac, Sarem, Symbiax, Selfemra, and Repiflox. For fluvoxamine, we have Lovox and Lovox CR. For paroxetine, we have Paxil, Paxil CR, and Pevexa. For cetraline, we have Zoloft. For vilazodone, we have Vibrid. And for paroxine, we have Pevexa, Paxil, and Brisdel. For the chemical names of the drugs, we have two: C17, H18, F3, and 0 for fluoxetine, and C17, H17, Cl2N for cetraline.
The drug classifications. For the therapeutic classification, this class of drugs is used to treat depression, anxiety, and other mood disorders. They are mainly prescribed to treat depression, particularly persistent or severe cases, and are often used in combination with talking therapy such as cognitive behavioral therapy, also known as CBT. As for its pharmacologic classification, it is an antidepressant in the treatment of major depressive disorder, anxiety disorders, and related illnesses to serotonin deficiencies. As for its pregnancy category, it is pregnancy category C. As to animal studies have shown an adverse effect, or there are no adequate studies in pregnant women, or no animal studies have been conducted and there are no adequate studies in pregnant women.
The mechanism of action of the drug. The therapeutic action of SSRIs have their basis in increasing deficient serotonin that researchers postulate as the cause of depression in the monoamine hypothesis. As the name suggests, SSRIs exert action by inhibiting the reuptake of serotonin, thereby increasing serotonin activity. Unlike other classes of antidepressants, SSRIs have little effect on other neurotransmitters, such as dopamine or norepinephrine. SSRIs also have relatively fewer side effects compared to TCAs and MAOIs due to having fewer effects of adrenergic, cholinergic, and histaminergic receptors. SSRIs inhibit the serotonin transporter, or SERT, at the presynaptic axon terminal. By inhibiting SERT, an increased amount of serotonin remains in the synaptic cleft and can stimulate postsynaptic receptors for a more extended period.
As for its pharmacokinetics, the 5 selective serotonin reuptake inhibitors, or SSRIs, fluoxetine, fluvoxamine, paroxetine, sertraline, and citalopram have similar antidepressant efficacy and a similar side effect profile. They differ, however, in their pharmacokinetic properties. Under steady-state concentrations, their half-lives range between 1 and 4 days for fluoxetine, 7 and 15 days for norfluoxetine, and 21 paroxetine, and 36 citalopram. R for the other SSRIs, sertraline and citalopram show linear and fluoxetine, fluvosamine, and paroxetine nonlinear pharmacokinetics. SSRIs underlie an extensive metabolism with high inter-individual variability whereby cytochrome P450 or CYP isoenzymes play a major role. Therefore, resulting blood concentrations are highly variable between individuals. Except for N-demethylated fluoxetine, metabolites of SSRIs do not contribute to clinical actions. Therapeutically, effective blood concentrations are unclear so far, although there is evidence for minimal effective and upper threshold concentrations that should not be exceeded. Paroxetine and, to a lesser degree, fluoxetine and norfluoxetine are potent inhibitors of CYP2D6 and fluvosamine of CYP1A2 and CYP2C19. SSRIs are well absorbed from the GI tract, metabolized in the liver, and excreted in the urine and feces. The half-life varies widely with the drug being used.
The drug's indication. SSRIs are a class of medication that are most commonly prescribed for the treatment of depression. They are often used as first-line pharmacotherapy for depression and numerous other psychiatric disorders due to their safety, efficacy, and tolerability. They are approved for use in both adult and pediatric patients. SSRIs currently have FDA labeled indications to treat the following conditions: major depressive disorder, generalized anxiety disorder, bulimia nervosa, obsessive compulsive disorder, panic disorder, premenstrual dysphoric disorder, treatment resistant depression, post traumatic stress disorder, social anxiety disorder. Other off label uses include but are not limited to binge eating disorder, body dysmorphic disorder, fibromyalgia, premature ejaculation, paraphilias, autism, Raynaud phenomenon, and vasomotor symptoms associated with menopause.
As for its contraindications, SSRIs are contraindicated with the concurrent use of MAOIs, linezolid, and other medications that increase serotonin levels and could put patients at risk for life-threatening serotonin syndrome. Paroxetine is contraindicated in pregnancy and lactation and is classified as category D or X due to its teratogenic effects in causing cardiovascular effects, specifically cardiac malformations, if prescribed in the first semester. Caution should be used with severely depressed or suicidal patients, especially children, adolescents, and young adults because of a risk of increased suicidality. Alcohol should not be taken with the SSRI because it can increase drowsiness and can make feeling of depression worse. Avoid drinking large amounts of caffeinated drinks such as tea, coffee, energy drinks, and cola while taking fluvosamine because it enhances the unpleasant symptoms such as palpitations, feeling sick, restlessness, and insomnia. Contraindicated to these drugs may cause drug-to-drug interaction. Non-steroidal inflammatory drugs, or otherwise known as NSAIDs, NSAIDs, such as ibuprofen, diclofenac, or naproxen. Antiplatelets such as low-dose aspirin and clopidogrel, theophylline, clozapine, and pymoside, lithium, triptans, other antidepressants such as tricyclic antidepressants, also known as TCAs, monoamine oxidase inhibitors, otherwise known as MAOIs, and serotonin, norepinephrine reuptake inhibitors, or SNRIs. SSRI may not be suitable for the following conditions: bipolar disorder in a maniac phase or a period of extremely excitable mood, although they can be useful for depressive cases. Bleeding disorders such as hemophilia, type 1 or 2 diabetes, epilepsy, SSRI should not be taken when epilepsy is well controlled, and it should be stopped when it gets worse. Narrow angle glaucoma, and also serious kidney, liver, or heart problems.
Side and adverse effect of the drug. SSRI's possible side effects include for the CNS effect, it causes headache, drowsiness, dizziness, insomnia, anxiety, activation of mania or hypomania, tremor, agitation, and seizures. For GI effects, it causes nausea, vomiting, diarrhea, dry mouth, anorexia, constipation, and changes in taste often occur. For the GU effects, it causes painful menstruation, cystitis, sexual dysfunction, urgency, and impotence. For respiratory effects, it causes cough, other respiratory infection, pharyngitis, and dyspnea. It also causes serious intraocular pressure changes with untreated narrow angle glaucoma. For other side reported effects, it causes sweating, rash, fever, and pruritus.
Nursing responsibilities before administering SSRI. A nurse should be certain of the identity of the patient before administering a drug and confirm this with the wristbands, and ask the patient for their name and date of birth, as well as ensure that the patient is not allergic to the drug. The nurse should have a clear knowledge of medication to be administered, which is the selective serotonin reuptake inhibitors or SSRI, its medical use, regular dose, reported adverse effect, and any specific contraindications or precautions associated with the drug to prevent any untoward complications. The nurse should also be familiar with the treatment plan of the patient and the need for the drug to be administered to the patient, and perform a thorough physical assessment to establish baseline data before drug therapy begins, to determine effectiveness of therapy, and to evaluate for occurrence of any adverse effects associated with drug therapy. The nurse should also consider the dose, the route, and pacing recommended and equate this with their understanding and experience. The nurse should verify the drug's expiry date. Arrange for lower dose in elderly patients and in those with renal or hepatic impairment because of the potential for severe adverse effects. Suggest that the patient use barrier contraceptives to prevent pregnancy while taking this drug because serious fetal abnormalities can occur. Provide thorough patient teaching, include the drug name, prescribed dosage, measures for avoidance of adverse effects, and warning signs that may indicate possible problems. Instruct patients about the need for periodic monitoring and evaluation to enhance patient knowledge about drug therapy and to promote compliance. Also, assess for any known allergies to SSRI to avoid hypersensitivity reactions, severe depression or suicidality, angle closure glaucoma, and bipolar disorder, which could exacerbate by these drugs, impaired liver or kidney function, which could alter metabolism and excretion of the drug, diabetes mellitus, pregnant or breastfeeding, because caution should be used in these situations and drugs are limited. Also watch for the temperature and weight, skin color and lesions, affect, orientation and reflexes, vision, blood pressure and pulse, respiratory rate and adventitious sounds, and bowel sounds, and abdominal examination for baseline status before beginning therapy and for any potential adverse effects, and also obtain renal and liver function tests.
Nursing responsibilities during administration. First, monitor the patient for up to 4 weeks to ascertain the onset of full therapeutic effect before adjusting dose. Provide thorough patient teaching, example measures to avoid adverse effects, warning signs, need for regular evaluation, especially blood pressure and etc., to enhance patient knowledge about drug therapy and to promote compliance with the drug regimen. Third, Provide safety measures, examples, adequate lighting, raised side rails, and etc. to prevent injuries. Fourth, the administration of the drug should be reported immediately in the patient's notes clearly and accurately, with the nursing signing and printing their name and documenting the date and time the medication was administered. Next, monitor for increased risk of suicidality and establish suicide precautions for severely depressed patients and limit the quantity of the drug dispensed to decrease the risk of overdose to cause harm. Next, administer drug once a day in the morning to achieve the optimal therapeutic effect. If dose is increased, if the patient is having severe GI effects of the dose can be divided. Serious name confusion has been reported with some of the SSRIs. Monitor blood pressure. Gradually reduce dose when discontinuing when possible. Use with caution with patients with liver or renal disease. And lastly, provide comfort measures to help the patient tolerate drug effects. This may include voiding before doing instituting a bowel program as needed. Taking food with a drug if GI upset is severe or environmental control. And nursing responsibilities after drug administration. First is to monitor patient to the drug, alleviation of signs and symptoms of depression, OCD, bulimia, and panic disorder. Second, monitor for adverse effects like sedation, dizziness, GI upset, respiratory dysfunction, GEO problems, and skin rash. Next is evaluate the effectiveness of the teaching plan. Patient can give the drug name, dosage, possible adverse effect to watch for, specific measures to help, avoid adverse effects, importance of continued follow-up, and importance of avoiding pregnancy. Next, monitor the effectiveness of comfort measures and compliance with the regimen. Offer support and encouragement to help the patient cope up with the disease and the drug regimen. And lastly, after prescribing the drug, the nurse should complete the necessary paperwork. That's all for the autobiography of the selective serotonin reuptake inhibitor drugs. Thank you for watching and I hope you learned something.